back to the Recovery Lab. This is Mike. We're going to continue our baseball arm care series today. I have a very special guest. This is Christian Tessitore. He's a pitcher at Old Westbury. Unfortunately for Chris, he kind of had a little bit of a UCL injury this year. So he's about 6 weeks out of his Tommy John surgery. And this is actually the first session that he's had with me to do tissue work since the surgery. So as you can kind of see, obviously, he's a bit atrophied through here, and we've definitely got some scar tissue adhesions. And kind of that window of time is about 4 weeks that we really want to kind of let all this kind of scar down before we really start, working on immobilizing the scar tissue too aggressively. But now it's kind of at the point in the healing process where we want to start getting these fascial layers kind of open back up. So like we talked about in previous videos, this scar tissue just doesn't scar together. It kind of scars down deep to that, and you can see like it doesn't really move all that well. Okay, so basically what we're going to do today is kind of like open up his pec. Again, we're going to open up some of these anterior scapular stabilizers because he was in an immobilized position for about a month. Okay, so all of this kind of stuff is really super tight. He's also limited in his elbow extension, so we're going to do some bicep release work. We're going to work on his forearm flexors. Really light today, just to kind of open up and soften some of this this protective tension up and create some blood flow. And hopefully by the end of the session we'll have full elbow extension and this shoulder kind of sit back a little bit better. So stay tuned and we'll get right to the step we're going to take here with Tess is we're going to kind of work on this pec, okay? Again, he's been in that immobilized position, so we kind of just want to open up some of these anterior tilters here, and we're just going to kind of give this pec a little bit of love, okay? So really, since he was in an internally rotated position, I'm going to kind of just work on those internal rotators, and the big three are going to be his pec, his subscap, and his lat are going to be those big three internal rotators. So again, kind of the same process as you've seen in some of my other arm and shoulder videos. So working into a little bit of retraction. A little bit dense in here, huh? A little tight.
Oh yeah.
How's that feel, all right? Not too bad. Oof, man. Tight in there, dude. Like I said, this is the first time I've worked on him in about a month and a half. So since the surgery, really. He is doing traditional physical therapy, and he's also training. So we're doing we're working on his other aspects of his body, like his legs, his core strength. But now we're starting to get to that point post-op where he can start to kind of work on some more shoulder work, scapular control, kind of getting this arm strong again. But he's doing great so far. Obviously, really we haven't had any hiccups or setbacks. So far, so good. We're looking at maybe return to throwing him around the end of August, right? Is that what you said? Okay, awesome. Nice. So I just worked on him there. Just gonna work him into external rotation. So again, he just had Tommy John. I don't want to put any excess valgus stress on this elbow. So I'm just gonna kind of let gravity do the work, and I'm not gonna kind of crank him beyond really 90 degrees external rotation, even though I know he's got more than that. Okay, so we're just gonna kind of work these tissues into external rotation. He's in this like 90-90 position. So really in that 2 to 3 month phase post-operatively, remember, he had a palmaris tendon graft, so we're replacing a ligament with a tendon, okay? And so structurally, tendons are a little bit different because they're not as elastic as ligaments are. Ligaments tend to have a little bit more elastin fibers in them, so they have a little bit more stretch. And in that 2 to 3 month window post-op, this ligament's going to start to specialize again. So it actually kind of degrades a bit. So with any post-op athlete, whether it's an ACL post-op, UCL, doesn't really matter. Anytime you're going to reconstruct a ligament with a tendon, in that 2 to 3 month window is kind of like that danger zone where this is going to actually kind of degrade a bit before it really starts to specialize and get a lot stronger. So in terms of training, we want to limit valgus stress as much as possible, or pretty much entirely. We don't put any valgus stress on this elbow at this point in his healing process, and then just kind of work kind of smart around his scapular stabilizers, working on his core and his hips and other things in his body. All right, cool. All right, so now we're going to go into some light bicep release. Again, same idea. I'm going to keep him in a neutral grip. I'm just going to kind of work him into extension as we load this bicep. And It's an important thing to note that this bicep, the short head of the bicep, is also a scapular tilter, okay? It attaches to the coracoid, so when this thing gets really jacked up and gnarly, it's gonna draw that shoulder forward, or that anterior tilt of his scapula. Wow. Not much left here, huh?
No, there's nothing.
That's okay, but it'll come back. So again, obviously, he's suffering from a bit of atrophy, which is kind of one of those necessary evils of, being a post-op athlete. So what's happened is the volume of each of these muscle fibers has shrunk. He didn't lose muscle fibers, they just shrunk down in size. And that's kind of a conservation of energy thing. You know what I mean? When you're, in terms of your body and your nervous system, when you're immobilized and you're not using that musculature for a period of time, basically what happens is your body just kind of leaches the protein from your muscles because it's easier to get than getting it from food, right? That protein and those nutrients are already in your body, so this is like energy ready to burn. So again, atrophy kind of happened really quick, and especially at a younger age. What are you, 20 now? Mm-hmm. Right? So at 20 years old, his metabolism is pretty high. It really probably only takes about a week to see significant loss of muscle. But again, he didn't lose muscle. It's there. It's just, it's a little bit shrunken down. It's a little deflated is what we'll call it. But we'll get these guns back in no time. Don't worry about it.
Summer shred.
That's it. The summer shred time. Exactly. So again, I'm just kind of giving him a nice little bit of pressure, and as I get him into extension, I'm giving a little bit of love, and you can already see just doing that bicep release is already kind of almost giving him his full extension back. So we're also going to go ahead and now work down to these forearm flexors, and this is going to be kind of the area that I spend a lot of time on today. And again, it's his first session back since the surgery. I'm not going to crush him, okay? This is, obviously his surgical site is going to be really sensitive, so we're just going to kind of work through these tissues and just kind of soften them up a little bit and give them a little bit of love. But you can see the scar tissue is kind of really well formed now, so this is the point in the process where soft tissue work really becomes an important part of the rehab model.
It feels so weird.
We got a little numbness out here.
No, not even numbness, it just feels weird.
It just feels weird to have somebody touching you in here. Yeah, man.
It's like tender.
That's okay. It's going to be a little tender. Just let me know if it's too much and we'll back off a little bit. Again, when we reconstruct this ligament, what happens is the doc, after he makes the incision, he's going to move this musculature out of the way. So there's a lot of trauma that happens to even these forearm flexors and pronators. So, when you start moving that muscle out of the way, you kind of like tear up those fascial layers, and all of those are going to start to get scarred down and adhere together as you heal. So, really what we want to have is all that musculature and the skin and the fascial layers slide and glide on each other nice and smooth again, which is obviously not what's happening right now, okay? It's why your wrist probably feels really stiff, your elbow feels really stiff, but once you kind of get warmed up, it feels a little bit better. As his tissue temperature increases, that elasticity increases, and after he does a heat pack, he's able to kind of get his arm fully extended, which is great. I didn't heat him up today. I just kind of we just kind of rubbed you and got you a little bit of heat that way. Ooh.
Yeah, that sounds bad.
It's gnarly in here, man. It's all right. It's good. Again, rehab is a process, guys. So it takes time. You definitely don't want to rush these things, and frustrating, right? That first month. Tell us about it.
I'm just impatient.
What's that?
I'm just impatient.
You're right. Well, it's you're a guy that's used to throwing a lot, and when you take away the sport for any length of time, sometimes the hardest part about rehabilitation is that mental part. And just kind of like you said, being patient is really, really tough. But we're 6 weeks out now, so things hopefully will start happening a little bit faster for us. Now get you back to training and kind of more normal day-to-day stuff that you're used to. Okay, so now what I'm going to do is kind of work on his pronator. I'm going to keep him at 45 degrees. A lot of times I'll work it in extension too, but on these post-op Tommy Johns, I'll just keep him in 45 because it's a nice open pack position for the joint, and we're just going to kind of work this pronator, okay? How's that feel?
Fine.
Not bad, right? Mm-hmm. This is not as bad as like that ulnaris on the outside part.
The outside one's like
really tender.
It feels good when you do it. It's just
right. That's okay. It hurts so good.
Yeah.
Right, and that's what we're going for. We're going for the hurt so good. Ooh, yeah. So anybody who's watched any of my other videos, you're probably looking at it, it's like, oh, Mike, it's the same thing that you did for your arm care videos. Well, yeah, you know, when I do my arm care stuff with these guys, I'm using treatment as a prevention measure. You know what I mean? So it's the same process. Only in this case, the reason that this is unique in this post-op is we just have to take special precaution, you know, not cranking on it too much and just understand where he's at in the healing process. So I like to be as aggressive as I can be with respect to the biology of the healing process, and that's where you're gonna get really good results. And that ultimately, in my opinion, is the difference between like physical therapy and performance therapy. You know what I mean? Because we're gonna kind of flirt with that edge of being really aggressive without being stupid. Okay, we're not gonna push him past where he's at in his rehab, but you know, we definitely want to push him and make him train other aspects of his body and just kind of let him be an athlete again. This one's still kind of really opened up. Has that opened up a couple of times?
Yeah.
Yeah? All right, so we're gonna kind of stay off that one today, but the rest of these we're gonna kind of get on there with the Graston a little bit. Okay, so here's what we're gonna do now. We're gonna do some really light Graston work, okay? And we're gonna do this a couple of different ways, and one way is something that we probably haven't seen before. So again, this is really in the light pressure range here. Elbows in a flex position. I'm supporting him from the back end as to not put him in any valgus. Tender in there.
No, it's just, I just know it's coming my way.
That's all right. Just breathe. Breathe. Relax. If it's too much, just let me know. We'll take a break. It's not a big deal. So right now, what I'm trying to do is just A, kind of open up these fascial layers, and B, just stimulate a little bit of collagen production. Okay. So listen. This surgical procedure is almost probably more traumatic than the actual tearing of the ligament was, right? In terms of like an injury. This is another injury now, so you got to treat it that way. And so we want to get this scar tissue to we want to treat the scar, okay? Because remember, your skin is made of the same developmental tissue as your brain. You know, when you're developing as a fetus, it's the same kind of tissue, your brain and your skin. Your skin is very, very sensitive. It's got a lot of sensory nerves, so treating this scar is super important for the rehab process. And I'm literally just using the weight of the tool right now and just kind of strumming it right over that incision site. Really, really light, just creating some blood flow. How's that? Not too bad, right?
Yeah,
So I'm gonna go into that bicep now. Let's get a little bit more butter. Is this all still like bruising or what? We got some bruising?
Like
Yeah. I'm sure it was all sorts of pretty colors the first time you took that brace off, huh? You know, so Tess is still in the brace. You know, when he's not kind of at home or when he's here, obviously he takes it off and we're working on range of motion stuff. So the brace is important because it kind of lets other people know that you got something going on and they don't just like run and jump on you and put you in a compromised position.
They cleared me off of that on Thursday.
Oh, nice. Okay, good. So are you still wearing it when you're out and about or not really?
Yeah.
Okay, good. Nice. I mean, the sooner we can get you kind of using this thing, the better off you're going to be. Oh, right there.
Yeah,
Oh,
that's
nice. Nice and feels good.
Hurts so good.
It hurts so good. So you can see some redness, no bruising though. We're not killing him here. And this is where I kind of like using this other Graston instrument. This is like a double bevel on there, so it's really, really soft, right? So this is a single bevel, meaning it's a little bit of a sharper edge. This one's double beveled, so it's a softer edge. So I can kind of get in here a little bit deeper without it being as irritating, okay? And obviously that contour fits really nice. So we kind of get in that bicep too. Okay, cool. All right, so after just a few minutes, we're pretty much at full extension of the elbow. Maybe we could probably have a little bit more to go, but we're not gonna force it. We're just gonna let it kind of happen naturally. Okay, so the next thing I'm gonna do is start working on some cross friction massage, okay? So I'm gonna use the other GT instrument for this, and basically what I'm gonna do is kind of pull some slack out of his skin. I'm just gonna wipe off some of this lotion, and we're gonna go against the grain here, okay? So what I'm trying to do now is kind of just release this scar from the underlying tissue beneath it, okay? Do pay special care with your UCL guys, okay? Because this ulnar nerve runs right through this cubital tunnel and you don't want to necessarily kind of be jumping over the ulnar nerve, okay? So, get in here. So you don't want to feel any like tingling or burning, all right? But I'm not even close to it yet, so we're gonna get in there in a second. And you also may notice that the scar gets really red very quickly. That's okay too. Remember, the scar tissue is really brittle compared to the skin and everything else that's around it. So it's going to reach threshold for this treatment a lot faster than the surrounding tissue. But that's okay. You know, doing this consistent Graston work or the consistent massage work will actually start to take these type 3 collagen fibers, which are very, very brittle, and start turning them into type 1 collagen fibers, which is, you know, much more tensile strength per fiber, okay? And that's kind of what we're looking for, is restoring this tensile strength. I'm also gonna kind of strum over that new graft here. Again, this is extremely light pressure. It's basically the weight of the instrument. Again, stimulating that fibroblastic production in this new graft will help it heal a little faster. Just bringing it some blood flow to the table and stimulating those fibroblasts to kind of spit out more collagen is just going to improve his outcome. How's that test? Not bad, right?
Yeah.
It just feels really weird. It's
yeah,
like
it's
numb.
freaky.
It's freaky, right? Yeah. It's all right. You know, I've been working with Christian for over 2 years now, so obviously he trusts me. He knows that I'm not going to put him in a position where he's going to be hurt, but it is a weird thing. So make sure that your clients understand why you're doing something before you just start taking a metal instrument and rubbing over their post-op scar. You know, if they don't understand why you're doing it, they're going to be apprehensive and anxious about it. So that's important to make sure they kind of know why you're doing what you're doing. Nice. Oh yeah. How's that test? Nice?
Yeah, it's just that outside of my forearm.
Yeah, it feels like it's more tender out here. Yeah, I hear you.
Yeah, right there.
Again, this is that like flexor carpi ulnaris. They kind of really yank this thing out of the way to expose that graft site, okay? Remember, there's also anchors in his bones here, so another reason we're going to wait till like 5 months post-op to really start throwing with him is you don't want to have a cubital tunnel fracture. Okay, guys that start throwing too soon after Tommy John, listen, in a month, he's going to feel 100%. His strength is going to be back. His full range of motion is going to be back. He's basically going to be back to training in the gym like he was before he got hurt. The problem with that is he's going to be tempted to throw a baseball. And if you pick up a baseball too soon in that danger zone, before that bone is really solidified itself again, you're at risk of fracturing the tunnel where they drilled that graft in, okay? So that's why, you know, kind of less is more, and just being patient and waiting for the biology of the healing process to take place, and then we can gradually stress his elbow again with a variety of different measures. Obviously, we're going to stress him in the weight room by lifting and training, but then we're going to start him on a long tossing program, which is going to be like 30 feet to start. It's going to be like basically just having a catch and stretching you out over a 4 or 5 month period of time. And then we might even mix in some weighted ball training, just to, you know, work on your stabilizers, your decelerators, kind of almost taking that optimal arm approach like we did over the winter, you know, in the later ends before we get you back up on the mound. All right, so same thing, we're gonna get into kind of these other graft, other incision portal sites, a little bit of cross friction. We can even take this second instrument and start to kind of do some like deeper massage work, okay, where I'm actually kind of pinning it down on one side. I don't know if you guys can see that. And basically just kind of scooping on this side. You can feel how crunchy that is, that scar tissue underneath. Okay, and these are gonna be real red, okay? Don't worry about it. They're just gonna be red in the color. In a couple days, that'll fade. And like I said, right now it's really important that I'm not gonna do this one because it looks still a little bit open, but right now it's really important that we just manage this scar tissue as it's maturing, okay? This scar tissue is gonna mature over the next year plus, okay? You're healing still a year from now. So we wanna really make sure that we're we're just managing this as we go. Right, so again, in terms of just even one session, obviously towards the center of the scar where that graft is, very, very tight. You can start to see he's gained some fascial mobility over this scar. Okay, so this is obviously going to be a process. This skin is definitely a reach toleration. It is warm to the touch. You feel that? How hot this is? That's blood flow, baby. We're bringing blood flow to the table and letting these things really recover. You're gonna be sore tomorrow, okay? It'll feel good to move it, like your wrist will be like, oh man, yeah, that feels better. But you're gonna be sore to the touch, like it's a little bit bruised, okay? All right, I already kind of hit up in here. So now what we're gonna do is just finish up with a little bit of subscap release, and then we're gonna call it good for today, man. I think that's a really good first manual session back. You know, he's in his rehab where he's starting to work on, you know, his body. Rock chip, you're in the center. He's gonna work on his, you know, his scapular strengthening, his bicep and tricep strength. So right now it's a lot of isolation work, and it's really just to kind of use the range as he's kind of gaining it back. You know, we're not gonna do like forearm flexor training. I see that a lot. Guys make that mistake. Right now, remember that UCL shares the same anchor as your forearm flexor bundle. The last thing you want to do is start cranking on that thing. All you're gonna do is irritate it, and you don't want to kind of avulse that new graft, okay? So you want to avoid any of this kind of wrist flexion and like really loaded pronation right now. But again, in a couple, like maybe in another 4 weeks or so, we'll be able to get back to doing some eccentric work there. That won't be a problem. Or even just your grip training in general, just getting you back to deadlifting and your heavy carries, your farmer carries, things like that will be really important to get your grip strength and your forearm strength back. So again, you guys have seen me do this for a little subscap release, okay? So again, another internal rotator, since he, you know, you could feel how really gnarly that is up in there. Just because he was immobilized for so long, you know, all of this tissue starts to get adhesed up, and you know, that can sometimes be a little bit uncomfortable. So we're gonna get in here, just kind of work on that. You know, normally I'd maybe bring him past 90 in this, but today I'm just I'm pinning him, and I'm just kind of letting gravity range him to 90. I'm supporting him the whole way, not to give him any valgus stress. All right, we're gonna finish this up with a little bit of lat work. All right, this upper portion of your lat. How's that? Nice? Feels good in there, right?
Yeah.
Just open this up again. You know, so as he's doing like his body weight lunges and things like that, we're gonna get him over his head, okay? There's no reason why getting him over his head in an unloaded position is contraindicated for a UCL rehab. In fact, he's a pitcher, so in the next few months, we're gonna get you overhead as much as possible. That's gonna be kind of the next step in his training. So that's pretty much it, guys, for me. If you have any specific questions or comments or concerns in terms of, you know, doing soft tissue work on a post-op athlete, please feel free to leave a comment in the description below. I'll definitely get back to you and answer any questions or anything specific that you might have. And obviously the concepts that we kind of talked about today go beyond even just UCLs. Like I do this with my post-op ACL athletes, any really post-op athlete. These same concepts would apply to. So if you like what you see, please remember to subscribe. We really appreciate the support. Definitely comment or, you know, leave any questions. Like I said, you can follow me on Instagram at MikeStella_ATC, or follow us here at Athletic Movement Protocol at amp_athlete, or visit us online at ampathletes.com. Thanks for coming to visit me in the recovery lab. Tess, you got anything to add? We're going to get better. We're going to get better. So we're going to get this guy back on the mound real soon. So thanks for visiting me in the lab, guys. We'll see you guys next time.